separate. But if we have some kind of an organization, then it will be easier to make Rita meet the rest of us, and then she can talk a little bit. Yours has a good experience in business. You have operated business here for 8 years, right? Around 7 years.
14 years.
14 years, oh my God. I missed that one. Yeah, so for example, yours could tell me, I've been looking for so long for someone to tell me how I could start operating my business here. And with this thing, if you are around, then probably not. She's also really struggling now with her business. I saw her videos on Instagram. But we're in the same thing. We don't know where to be. It's like somebody who's drowning, and we're like, what's happening here? But so if yours is also here, then they could tell a story. This is what you're supposed to do. This is what you should expect. And so this is how I came up with this idea. And like examples I've shared, what I think should be done with this community, number one, is integration itself. Like people should be able to just meet and talk and have fun and stuff like that. And it's why I also started this jogging stuff. That's where I thought first. So I think maybe you don't know about it yet. We are meeting the stadium. Is it the stadium? Is the sports center in this direction. So I'm putting the other right. Yeah, so we normally meet and jog. We've met 2 times, if not 3 times.
I've been there twice, but
yeah, like 3 times. So we just run, and then we talk about music. That's where he also shared his experiences here, and it's a nice place. We don't have a good response yet, but it's the beginning. So for me, I'm expecting what we are getting, and I'm expecting more in the future. But number 2, we would have some sort of classes or orientation. For instance, last time I mentioned like taxes. Also, I got myself in big problems with tax returns. I didn't know about the prepayment tax and whatever. Because before I was operating as an employee, your employer does everything. So you just get your money, they just take it everything. Then I went to operate as a ward. There was a prepayment, nobody told me anything. I had given my rights to UCOPRO, and I thought UCOPRO, they were managing my taxes. And then the year passed. The next year, then I received a letter from the tax office. They said, here are 4,000 euros, you have to pay us in few months. And it was very shocking. And I asked why, because I've paid all my invoices and on time. I normally pay so much on time. Then UCOPRO, they said, sorry, that's the business you're supposed to handle yourself. But I'm already in it. And I try to talk to tax people, they don't know what they say, but I'm sorry, but that's our money, so you have to give it back. The best thing I did was to ask them to pay it in smaller amounts, and they gave me, okay, the best we can give you, you have to pay 250 every month, and this is also a very huge amount of money compared to amount of money. But it's the best they did, and I had to accept it. And it was, it has been giving me also a very good time. I mean, a very tough time. So it's the reason also I suggested that we could be talking about now, for example, about taxes, about the benefits, health benefits. Finland is being mentioned as one of the countries with the best healthcare system in the world. But how much have you experienced it? If somebody asked you, so...
Well, I was shocked that, not shocked, but I felt a bit low sometime when I received a letter that I had to pay money. And I didn't understand. It wasn't much, but I didn't understand why. So I called, and I was in the school then, so she spoke with my teacher there, because she couldn't explain to me in English. So she spoke to her, and she explained to me that I just walked into the hospital. That's why I'm paying that amount. And I didn't know I had to call a certain number first and ask and tell them how I'm feeling. And so they'll say, okay, you can do this, or okay, come to the hospital. So I paid that amount because I didn't call. So that was one thing I knew that avoided that.
Yes, so this is what I'm talking about. That they are not lying when they are saying Finland is the best healthcare system, but how do you get to know how to benefit? So that's another question. I don't know about Finns. I don't know. How do Finns know how to benefit from this thing?
Not all. No.
And then if you look at you saw the, areas, we don't know how that's going to work out.
Yeah, because it was just in the beginning of this year we started a very big change in health and social care sector. So we have 19 areas around, and for example, for us it's Mikkeli, Savonlinna, Pieksämäki. The whole area belongs to the same. All the healthcare units are belonging to that huge area, and there's so many things which are in change or will be changing soon. And they have created a lot of digital services, for example, which are, for me, they are very good for some people, but not for all. Yes, and people don't know exactly how the system will go and how to take a call or whatever when they have some trouble or say. Yeah, so we are in transition kind of thing. So it's very much new things also for Finnish-speaking people.
Yes, so the same for education, for instance. Finland is, I think, is having one also of the best education systems. But for instance, in your experience, how would you talk about it? Like in your own personal experience.
The education system.
Yes.
I haven't experienced it so much. I'm studying now on this immigrant course, and I think it's great. It's an online course.
Mm-hmm.
We study every day. You can see how much everyone's improved. We receive support, a lot of support, not only learning the language but also the culture. And I suppose things that you're talking about, we could ask our teacher and she could help us. So that's good. I've spent time in a päiväkoti. I learned a lot there. I know that the education system in Finland is very good.
What's the course that you're doing? Who's organised it?
Easy.
I think it's integration language courses,
Really
kotoutumiskoulutus.
But who provides them?
Yeah, TFS.
Sounds good. Maybe I should join.
It's very good, yeah.
Yeah, but the problem is that the systems are good, the services are good, but the problem is how to get into them and how to get the information to know them.
Yes.
And I'm very worried about that. And I really don't want anybody to check an appointment for somebody just to get some information. Everybody should have the right to find that information by himself or herself.
Yes, and I even I saw just one. It was like a quote. I went to quote your immigration office, and they said everybody should speak for yourself. So they were emphasizing for women. I think maybe for most immigrant people, a man would always have to speak for his wife. So they're kind of this supporting everybody to access for it because they can tell you as much as they can tell your husband. And I think it should be the same. And here it was, so that's the situation. And how would we do that? In mind, I'm thinking we should be able to access somebody from the hospital, maybe, or even from the city office and ask them, you say there's so much benefits from the healthcare system, so how do we get benefit? as international people or even as Finns. So they tell us, maybe we can invite them here, they can tell us 1, 2, 3, 4, 5 on the regular basis. So this is the point.
This is a very good point. I've been speaking with Rita about this. What the city council could do, because I don't think it's really, okay, it's our job to go and get the information, right? But I think that information should be accessible and you should be able to get it easily.
Yes.
So this gap that you mentioned is great. How can we close that and what can be done? That would be interesting.
Mm-hmm.
And I think that there's a, if you use a good, we're going to work with that with our social democratic group, and we're going to try to put together some kind of list of things that we can improve. And with working with retail, so I mean, you guys, your suggestions how we can do that, do a better job. Because it's like the foreigners are here, and then the so-called foreigners, and then the Finns are here, and nobody, it's like it's fragmented.
And and this is where I hope this Mikkeli International Community should come in this place, so that it becomes the kind of a bridge.
International Community is one example, very small example, but one example.
Yes. So another reason which is behind this is because I spoke a little bit, I gave a speech, if you remember, on the Mikkeli International Day, and I mentioned this, I don't know if Rita, you could remember, because you were so busy translating. It's hard to understand the message if you're a translator. Sometimes, actually one day I was asked by one lady, I think she's almost your age, and she's my friend and I really respect her, but she mentioned one thing. She said, why don't you just go back home to your country? And I said, why? She said, because we are paying so much taxes for you guys. We are paying so much taxes and you just get to enjoy the benefits. Yeah. And then I realized she doesn't understand that not everybody is using free money here. Actually, if you get some problems, like everybody else, then the carer steps in.
That's your right.
Yes, but apart from that, you have to work and stuff like that. But later I realized she had a point on her perspective. And the perspective I received from her is that they don't believe if most foreigner people contribute anything in this country.
Yeah, I think that's a very unfortunate situation. Yeah. I mean,